Moyer, and I will be discussing social determinants of health of the country of Haiti. Haiti is in the Caribbean islands and has a population of 11.12 million people as of 2018. The island is shared with the Dominican Republic. Although the island receives hurricanes 1 to 2 times a year, the Dominican Republic side of the island has more infrastructure. Many Haitians try to escape the poverty and go to the Dominican Republic for work. However, the Haitians are darker skinned and are looked down upon by the people living in the Dominican Republic. Often, jobs are found in the sugarcane fields. However, the conditions and wages are extremely poor. The island, unfortunately, has seen devastation from earthquakes, hurricanes, floods, AIDS, HIV, and now COVID-19. The healthcare system is illness and crisis oriented at this time. The country's goal was to be able to provide universal health care, but this has not happened. The health system in Haiti is struggling. Infant mortality increased from 73.8 per 1,000 live births in 1996 to 80.3 in the year 2000. Neonatal infant mortality has increased from 2019, which was 28.72%. The rise is associated with increased poverty, deficiencies in the healthcare system, and the impact of the AIDS epidemic. HIV/AIDS adult prevalence rate in Haiti is estimated at 5.6%. One positive in the healthcare system was that malaria went from 8.73% of deaths in 2010 to decrease to 1.61% in 2018. Deaths from rabies has also been decreased. The country's infrastructure and economic stability is very poor. About 65% of the population lives under the national poverty line. In 2010, an earthquake killed 220,000 people and injured over 300,000 people. This earthquake took down the public health department building and the National School of Nursing, which had 90 students and all of the instructors in it when the earthquake hit, and they were all killed. There's a lack of resources and medical staff on the island to meet the needs of the people. Also, the people tend to seek care from informal healers, like voodoo doctors in their village, which is less costly and more readily available. Often, by the time they seek Western health care, it is too late. In 1990, infant mortality in Haiti was 100.2 per 1,000 live births, compared to 2015, where it was 59 per 1,000 live births. And this is what made me develop my PCOT question. In pregnant women, does having a trained healthcare provider decrease maternal complications during delivery as compared to no healthcare provider over 1 year? So they were able to decrease infant mortality by about 40%, which was amazing. However, it's still significant. They still have a ways to go. The world has about 4.37 nurses or midwives per average 1,000 people. However, in Haiti, there's only about 0.68 nurses or midwives per 1,000 people, which could be some of the reasons for the increased neonatal and infant mortality rates. And what could be also helping is that women are traveling over to the Dominican Republic to seek better maternity care given by non-governmental organizations or NGOs. Often a lay traditional birth attendant will be at a Haitian's birth, but these attendants have no formal training and have no education levels, which is detrimental because they're not trained properly. The NGOs and Haitian government need to come together to collaborate healthcare to improve maternity care and decrease mortality. There needs to be government infrastructure to pave roads and improve public transportation. Economic researchers report there's a negative effect of developing countries receiving foreign aid. It can lead to more corruption, a sense of entitlement, and dependency. Overwhelming the barriers of corrupt government and those in our authoritative positions accepting bribes needs to be stopped. But this is not an easy task. Women who have higher level of education and have higher socioeconomic factors are more likely to seek maternal care. The American Red Cross received approximately $487 million to provide food and shelter after the 2010 earthquake. However, the American Red Cross reports that they aided Haiti under the Haiti Assistance Project, which subcontracted to other organizations. This is the fraudulent abuse that occurs when dealing with substantial amounts of money. The American Red Cross could not provide the numbers of where all the money went and then kept $124 million of its own for its own operational expenses. It seems that the people on the ground never see the help. It is infuriating that the upper class can steal and pocket the money when people and children are dying of malnutrition. The public health investment in 2004 was 16.6% of the total Haitian government budget. However, in 2017, the total public health investment of the government was only 4.4% of their budget. NGOs need to work with the government to establish and implement goals together by working on the same team. The more educated and the higher the socioeconomic status, the more likely the person is to seek maternal health care and health care in general. Haiti has many NGOs trying to assist them, but the left hand does not know what the right hand is doing, and there remains chaos. The government plays a huge part in the society's health, which I never really considered or thought about prior to this class. It's been very eye-opening to me. Urban and rural facilities vary in the services they can provide in Haiti. However, in urban areas that contained good services, there are pockets of maternal health disparities, even though the patient resided close to the facility. Costs of the treatment and their husbands not feeling that the care was necessary influenced the woman's decision on whether to seek care or not. As of 2018, nearly 820 suspected cases and more than 9,000 deaths have been reported. The CDC and a major partner in Haitians' long-term cholera elimination plan has began in 2010. 98% of all pregnant women seen at the healthcare facilities are tested for HIV now. So these are just some of the different things that the CDC and the Global Health Department is trying to address. They also decreased rabies by 60%, which is significant as well. So in conclusion, the NGOs are trying to help, but need to communicate and work better to improve health outcomes, especially maternal and infant care. The government needs to make the budget for healthcare larger than just 4%. And those women who have higher education are more likely to seek healthcare. There needs to be training for nurse midwives and having facilities that can handle maternity emergencies. Lay traditional birth attendants who have no formal training could be certified and provided training to recognize medical emergencies. Maternal mortality is still a challenge because of the lack of skilled, educated providers qualified to treat GYN complications. There also needs to be government infrastructure to pave roads and improve public transportation. This would provide jobs and assist the economy, and the government could provide scholarships or competitions to encourage people to go into the medical field. The current nurses and physicians need continuing education and support to help prevent burnout. Thank you so much, and I hope you all have a wonderful holiday. And if you have any questions, please feel free to reach out to me. Here are my references, and I thank you for your time.